ALS. ALS, or amyotrophic lateral sclerosis, is formerly known as Lou Gehrig's disease, that is named after a famous New York Yankees baseball player who had the disease. Unlike GBS and MS, which are both autoimmune disorders discussed in my previous videos, ALS is a neurodegenerative disorder that affects the motor neurons. ALS is thought to be associated with excessive activation of glutamate, which is a neurotransmitter that sends messages between nerve cells and motor neurons. Excessive glutamine leads to increased intracellular calcium and triggers cell death of neurons. It affects the upper and lower motor neurons in the brain and spinal cord, causing atrophy or wasting of muscles. The word amyotrophic in ALS means muscle atrophy. About 90% of ALS cases are sporadic, meaning the disease seems to occur at random with no clearly associated risk factors and no family history of the disease. The rest of the 10% are considered familial or hereditary. There is also evidence that smoking is linked to ALS. Signs and symptoms. ALS affects the upper and lower motor neurons and may manifest the following symptoms. There is muscle weakness that may occur on one side of the body parts and becomes symmetric as the disease progresses. There is also painful muscle cramping with movements, typically in the early hours of the morning. For example, muscle cramping can happen while stretching in bed before getting up. Fasciculation, or muscle twitching, is a sign of disease progression. Hyperactivity of reflexes that are associated with muscle stretch. For example, the knee-jerk reflex, and this will cause muscle stiffness. ALS can also affect the bulbar muscles, which are the muscles in the head and neck that control chewing, swallow, and speaking. This can lead to dysphagia, or difficulty swallowing, dysarthria, or difficulty speaking, sialorrhea, or excessive drooling. There may also be involuntary and exaggeration of emotional expressions, such as crying or laughing. As ALS progresses, it eventually causes such severe dysphagia and dyspnea that the patient is unable to speak above a whisper, swallow, or breathe effectively, and generally dies from respiratory failure. However, sensory, bowel, bladder, and cognitive functions are preserved throughout the disease, which means ALS patients are pretty aware of what's going on, and that's why most feels like they are trapped in their bodies. Treatment. There is no cure. Patients with ALS can live up to 5 years after symptom onset. Treatments are aimed to slow progression of the disease, improve quality of life, and extend survival. There are 2 FDA-approved disease-modifying treatments for ALS, Riluzole and Edaravone. Riluzole decreases the level of glutamate, which is the neurotransmitter that is responsible for causing ALS, and therefore reducing the damage to motor neurons. Edaravone acts as a neuroprotective agent that prevents oxidative stress damage to nerve cells. Some medications can be prescribed to help with symptom management. For example, baclofen and tizanidine help with muscle cramps and fasciculations. Modafinil helps with fatigue and weakness. Anticholinergic drugs such as scopolamine patches, oral amitriptyline, and atropine sublingual drops can reduce sialorrhea or excessive drooling. Antidepressants can be used for the pseudobulbar effect. Nursing interventions. As with most neurologic disorders, monitoring for respiratory compromise is always a priority. Because of the weakened respiratory muscles, it is difficult for ALS patients to clear phlegm or mucus. So it is important to maintain a patent airway and prevent aspiration pneumonia. There are cough assist machines that simulate a natural cough by applying positive pressure to inflate the lungs and use a vacuum-like suction to pull the phlegm. Non-invasive ventilation may be needed to reduce the work of breathing through a mask to prevent or manage hypercarbia and hypoxemia. As the disease progresses, artificial airways and mechanical ventilation may be life-sustaining. Safety and preventing falls are the next priority. Nutrition support such as feeding tubes may be needed. Involvement of speech therapists for strategies to speak. Here is a summary of ALS for any of your nursing exams. ALS is a common neurodegenerative disorder that affects the upper and lower motor neurons in the brain and spinal cord and is thought to be associated with excessive glutamate. ALS causes muscle atrophy, weakness, and painful cramping that typically occurs in the early hours of the morning. Other common symptoms include fasciculation, sialorrhea, dysphagia, dysarthria, hyperactivity of reflexes, and the pseudobulbar effect. It will eventually lead to respiratory failure. 2 FDA-approved disease-modifying treatments include Riluzole and Edaravone to slow progression of the disease. Respiratory support is a priority, and measures include cough assist machines, non-invasive ventilation, artificial airways, and mechanical ventilation.